everyone, I'm doing a video presentation on blood disorder, sickle cell anemia. My name is Chinua Eda. What is sickle cell anemia? Sickle cell anemia is a blood disorder that affects the hemoglobin, which is a protein found in the red blood cell. Hemoglobin helps to carry oxygen throughout the body. For you to have sickle cell anemia, you have to have inherited two abnormal genes, one from each parent. And this causes the red blood cells to change shape. So instead of having a flexible disc shape like this, we have like a sickle shape cell. Sickle cell anemia, like I said, is a genetic condition. Most of the people who have this originate from Africa, South or Central America, the Caribbean, Mediterranean countries, India, Saudi Arabia, Turkey, Greece, Italy. In sickle cell anemia, the red blood cells are sticky and they become stiff. Let's talk about the pathophysiology of sickle cell anemia. We know that sickle cell anemia occurs due to the mutation of the beta gene, creating the hemoglobin S. So as we said, hemoglobin is responsible for transporting oxygen throughout the blood vessels. So as we see right here, this is a blood vessel. This is a normal blood flowing through the blood vessel. We see these blood cells are round and nice, flowing nicely. But over here, we can see that the blood due to this genetic condition, forms the sickle, has this crescent or disc shape. And as they flow through the vessel, they clump together over here. And clumping together definitely restricts blood flow, and this causes a lot of pain. Therefore, this is what we call sickle cell crisis. Sickle cell crisis is a result of pain to the organs, mostly the joints, due to the clumping together of sickling blood cells. So when you hear a sickle cell patient complain of pain, they are definitely in a lot of pain, and this is due to the clumping of the blood cells that had restricted the blood flow. Let's talk about the relieving symptoms. We could give them oxygen, definitely to oxygenate their blood. We could give them pain medication, and you could give them antibiotics. This is to prevent further infection. Hydroxyurea reduces the frequency of painful crisis, and also might reduce the need for any blood transfusion and hospitalization. Blood transfusion may reduce the risk of stroke. You could also give them vaccinations to prevent infection. And bone marrow transplant has also been used for sickle cell anemia.